Hello, I'm Dr. Melina Roberts, author of Building a Healthy Child, and thank you so much for watching. I'm so excited that so many people are watching my videos. I think we have a huge opportunity here. We have an opportunity to be able to build health in our children, to be able to prevent common digestive disturbances, prevent common childhood illnesses, be able to support proper growth and development, and build a solid foundation for help for their long-term health. So I have a lot of people asking me questions about this program, and so I want to just go through the most common questions I get. Now, this is a question I've been getting. Some of the research, I guess the recent research is saying to introduce allergenic foods early, but I'm saying to introduce them later. Can you explain your point of view, because I'm confused? In terms of food introduction, yes, I recommend that you wait and that you introduce those allergenic foods later on, because there's a body of knowledge which shows that in terms of our human microbiome, that it's fully established between those early years, between birth and age 3. And what's shown is that when we really build that human microbiome and we build it well, it plays actually a big role in how our immune system functions. And if our immune system is functioning appropriately, that means that when allergenic foods come in, that the body will respond appropriately instead of doing any sort of big reaction. My philosophy is that we need to build the groundwork first. We got to build that microbiome. We got to build up that immune system and make sure that that system's strong before we introduce any of those allergenic foods. And I think that those studies were done on patients in terms of the average patient. But these are, what I've seen in my practice, which I know is not completely scientific. It's really anecdotal information, so that might not hold a huge amount of ground in terms of the scientific community. But what I've had in my practice with people who have diligently followed my program, that they have, I've seen not just a decrease in allergies, I've actually seen no allergies and no anaphylactic allergies as well, which I think is pretty significant as well. So in terms of this, I say wait and make sure you build the foundation really strong. My Building a Healthy Child program is based on 3 main concepts. One is that our human microbiome, so that's all the microbes that live within our digestive tract, that they're established between birth and age 3. So we have to be really careful how we introduce foods in those early years. The second part of my program, or the second concept that my program is based on, is that the organs mature at different rates. So we need to be introducing foods in line with organ maturation in order to support proper growth and development. And the third concept that my program is based on is that our bodies are hardwired to break down real foods. So we need to be feeding our children real foods, not chemically latent, manipulated, sugar-filled foods. We need to be feeding them real foods. So thank you so much for watching, and until next time, continue to learn, grow, and build health.